Thank you. Thank you very much.
Thank you, Dr. Sandeep and Dr. A.K. Gupta, sir, and all other participants. Good morning, good afternoon, and good evening. Welcome to the 1003rd day of continuous and uninterrupted Zoom session of Ifph. Let us start today's program with a silent prayer for. Thank you. Today, our guest is Dr.Ameer Nazeer Malic from Pakistan. He's Ambassador of Health and Humanity, IRAWA UK. Member Supreme Council, IRAWA UK. IFPH member, BLS King University UK and American Heart Association USA. NAI member, National Academy of Young Scientists member, MSc Biochemistry, BSc Biochemistry, DHMS and RHMB Punjab. More than 25 years of experience. You all know this is a wonderful person, can talk about virtually anything under the sun. That much potential he has got. A lot of knowledge is there, but he's always joining late. Today also is not an exception. I think he's yet to join. And the topic is surgery and pulmonary valve replacement case. A wonderful case, an interesting one, very difficult one. And of course, a person like Dr. Ameer Malic is capable of doing all these things. You have to wait for a few minutes now. Meanwhile, IFPH is about to, we have already celebrated our 1000-day program, and tomorrow is our 1000-day celebrations at Trivandrum, Kerala, at Hotel Grand Hyatt, a big hotel. It started at 9 a.m. Indian time and at 5 till 5 o'clock with around 10 sessions from different doctors who are participating in IFPH platform, including Dr. Mustafa, who is a veterinary surgeon and expert, a man with golden hands, and of course, a lot of other persons. And also, we gave importance to the next generation, that means students. They're also participating and presenting some interesting topics in the IFPH platform. That is the main agenda. Moreover, we have arranged 2 programs, one in the All India Radio, a music program combined with possibilities and prospects of homeopathy for 1 hour program that was telecasted today, and tomorrow there is a supplement in the local newspaper, one full page color supplement on IFPH seminar, this 1000-day celebration, that is also we are doing. So our aim is to propagate unconditionally homeopathy. We all know that we are all the beneficiaries of homeopathy. So we know that no more further explanation is needed, but what is needed is we must popularize it. We must fire all cylinders. That is most important thing with all efforts for the next generation. That is most important. If anybody would like to participate in the discussion and have some ideas to communicate with us, you can. Yes, our Dr. Ameer Malic joined. Yes, welcome Dr. Ameer Malic. We have already completed the formalities. You can go directly straight to the program. Yes, you can unmute. You are the co-host.
Honorable Sir Dr. Good evening, namaskaram, greetings to all. Extremely sorry for getting late due to some guests from. So I hope our honorable members, doctors, creators, our homeopathic. God bless you all. Audible?
Yes, audible. Please proceed. We have already completed the formalities, and Dr. Hubert informed that the file you sent cannot be opened due to some technical problems. Unfortunately.
Very important is that I have shared videos and so doctor just told me Dr. Hubert shared the documents and the videos of the patient.
Yes, but unfortunately, he was not able to open their file. That is a problem. He just informed me.
Okay. Oh, sir, then I will forward to you.
You can have the session without the this screen sharing.
Without
I shall contact Dr. Hubert once again. Please, please proceed.
Okay, okay, sir. Okay. Okay, let me start today. Surgery and placement of pulmonary valve. I will start. Tetralogy of flow. Tetralogy of flow is known of tetralogy of flow. Remember the pronunciation. Tetralogy of flow. Heart, where when there is a hole in the heart, there is a defect in the heart, and there are 4 types of TOFs. TOF is that one is the case is the VST, ventricular septal defect.
Excuse me, Dr. Ameer Malic or Dr. Hubert just joined.
Okay,
Dr.
that's
Hubert,
great.
what about Dr. Hubert? Please unmute.
Not in a Yes, I am not in a position to talk now.
Yes.
So I cannot. I tried many times, but it is not possible to open the files.
Dr. Ameer Malic, could you please resend the file to Dr. Hubert?
No, I could not, because it is opening. It can open in the mobile, but it is not open in the computer. That is why I am not possible.
If it is possible, you can open the mobile, Dr. Hubert. That's also an option. Please try for that, because it's an important topic. We are very eagerly waiting for it.
Okay.
So I continue the lecture, or you, sir, may I forward you the videos and reports?
So it is not. I could not.
Okay. Honorable Dr. Manoj, you said
Now you continue. After that, I shall try.
Yes.
I shall try.
Yes, Dr. Ameer Malic, now please continue. Dr. Hubert will try later. Okay. Yes, Dr.
Okay,
Ameer
sir.
Malic, please. Yeah. Yes.
Actually, sir, this is a case 18-year-old boy. Name is Mohammed Sam. Mohammed Sam Wakar. That patient father visited my clinic on 9th April. Recover the hole in the heart or pulmonary stenosis or overriding of the aorta or the disc replacement of the aorta. And 4th is the VST, ventricular septum defect. What is this? What is VST? VST is a situation where the lower chamber of the heart, into the wall of the lower chamber is a hole. If that hole is more than 10 mm, then the TOF surgery was advised. It's just like a patch in the heart to just fill up the hole, so the blood can have to flow from heart to lung. So TOF is common defect in which obstruction of blood flow from heart to lungs cause low oxygen level in blood. So the children is known as the blue baby or the syndrome. In the homeopathic, unfortunately, they have only known that they have to go for the surgery, and that surgery, which is within the is known as TOF. TOF, tetralogy of flow. Flow. This is very important. We must know noun TOF. It is easy to recover the VST and AST cases. This is so simple. It is also the birth is in the heart of right arm. Right chamber of upper, the hole is in the right chamber of upper heart. My sound is clear. I'm asking for the sound. Is my sound is clear?
Some problem. Oh, no. Okay. So maybe due to
There. Okay. Okay. Slow my.
This audible is audible, but there is.
I very fast. Please wait. Hello, sir. My voice is clear now.
Yes. Good. Please proceed.
That's good. I will start again because everyone can hear the case today. Case is important. That case had been completely destroyed by the allopathic cardiac surgeons and other doctors. What is that? 18 years old boy, Muhammad Sebaka. His father visited clinic on 29 April 23. Known case of VST in the childhood have been recorded by the TOF, tetralogy of Falun. And when he grew up, he is 18 years old. 3 months before that, having a critical cough, non-stop, without any, either he lies, he stand, he walk. The parents get conscious because they know it's a baby by birth, and maybe he is having some another medical issues. So they rush to cardiologist, pulmonologist, and they have diagnosed that that boy pulmonary valve is not working proper. It's sick with the valve of the arteries and cannot throw or push the blood into the lungs properly. So this is the reason of excessive cough. So they advised the surgery, and they said we have to replace the pulmonary valve. First of all, of our honorable doctors have valves in heart, the mitral valve, the trachea valve, the aortic valve, and the pulmonary valve. S1 and S2, the murmur of heart sounds, and the sound of the heart is known as loop, dup, dup. The S1 is the mitral valve and trachea valve, and the valve and the pulmonary valve. The systolic and diastolic is the filling and the empty of the heart chambers from the blood. It's full, systolic, then when it's empty, when it's full, it's diastolic, it's empty, it's systolic. So this is the base, just like the carburetor of car or motorbike. Heart is like this. The design is by the God. So as the pulmonary valve, the patient is having continuous cough, and that by having the history of TOF, tetralogy of flow, which means there is the 4 different effects in the heart which was recovered by the surgery. It's known as the blue baby syndrome. So, and there is one more option, 5th type of EST. The hole is in the right atrium of heart. What happened when the cardiologist checked 18 years old? He said he needs the replacement of pulmonary. So 50 or 60 years, they use place with the heart of cow valve. They take the valve of cow heart. It's a good valve. Second is the monkey. Third is the pig. But one of cardiac surgeon, he said the valve in the pig has more and functional nearest to human heart as compared to cow and donkey. So they place that valve, cow valve. After the replacement, open heart surgery takes place when they pack the heart and valve. After 2-3 hours, they feel, the surgeon said, the heart place is not right open. So again, you have to open the chest, and the adjustment of the heart to bones is again they open the heart, open the chest, and just change the place of heart and put it on the right direction. After that, when they closed, during the process, there is a critical lack of oxygen within the children. Why? And this we need to go for the isoelectricity. This is the only hope for them when they use a high voltage electric supply to brain to just overcome the hypoxia, the lack of oxygen in the brain, and the function from brain to heart could be regular. So they use the burst suppression pattern known as isoelectricity, and they give that boy to recover the OD, and the hypoxia in the brain. After giving the high voltage of electricity, there is no response. The hypoxic ischemic encephalopathy was found with brain odor, and the patient became conscious. After 48 hours, that patient became conscious, but he was unable to talk, unable to move, just in coma, and only move his eyes. Unfortunately, movie is not there. You can see in the video that how the boy is behaving. So that's why more than 2 months, the surgery was done in February, and source occurs. There's a lot of red source, and he cannot move his legs, hands. Everything is stopped. He is on oxygen, and on daily basis, he is taking 3 to 4 kg of oxygen in the whole day. Without positive oxygen, he can breathe. Critical breathlessness, shortness breath, and dislocation, and difficult to he cannot talk. Means urine and stool is on the bed. Totally he is in public condition. Actually, to try to video, it is will work how he looks like. So I started on 29th, 4th, 23. It's a miracle that that patient is in literally coma, and after giving the medicine, the visit yesterday more than 2 days. The movement comes in the hand, the edema of brain getting reduced. The sportive oxygen was discontinued since 20th May, just after 20 days of homeopathic medicines. No more stiff medicines. The crushing of teeth, the jaw is totally restricted like this. The food is censored. He cannot take the soft food, only his own diet, and there is no eyeballs movement and eye blink. All these symptoms just recover in 20 days. He is smiling, the crush of teeth is okay. The sportive oxygen was just quit on after 20th May, and as he started to move the eyeballs, he blinked, and incredibly, he smiles. He smiled after just 20 days. And the stool and the urine. The urine, the color of urine is getting improved. Before that, the medicines, the homeopathic medicines, that patient urine color is white and light color. And after having our medicines properly yellow color, and the first incredible symptom is that he moves his right hand, his fingers like this. In this condition, he just fold his fingers like half partially fold, not completely, and then he release his fingers like this, and he put his hand on the bed, was lifted and put on this, and the froth, a lot of froth comes from his mouth, and that froth stops the sputum. They mobilize their son more than 10 times a day. And now yesterday was mobilized only once in the whole day. The movements comes back, the edema on the brain is, and the hypoxic condition is removed. That's just okay. Okay. So 21 days removed, heartbeat and blood pressure is normal. I asked to his father, why don't visit a homeopathic doctor before surgery? Because in the homeopathy, such are needed if the patient go and visit to a proper homeopathic doctor, because in our homeopathic medicines, there are a lot of medicines to recover the pulmonary stenosis, to recover, restore to the VST cases, to cure the EST birth defect cases. They go for the surgeries, and we have the to cure these symptoms. And these the cactus, malaria, lipidium, and Gardenia, and the case of pulmonary replacement is to this system, that attachment pulmonary valve with the in homeopathic bryony, phosphorus, basilinum incredibly work to recover the valves. Second thing, those patients crush for replacement of valves, these are made of protein only. After the replacements, there are 4 or 5 defects, never no for this process. And what is that? Have the heart of cow, the heart valve of, from cow or monkey or pig. 3 problems with that. If it is it is within the home, if little bit get caught it, the valve stopping. Man moves in the rain and the storm, any kind of electricity or water can make a disorder to the function of the valve, because valve is made of protein. It's not a big science. Big science is that your medicines have the ability to cure that protein valve. Third thing, when of patients move from the scanners, the gadget scanners, the radiations, they may their valve have a distance. These symptoms occurs when the patients go for the heart valve patients. So try your best, either for the athletes, either for the sportsmen, either for the heart patients, to recover and restore the natural valve by the God to humans, because it can be repaired very well. There is some more sports remedies and sport injuries where, and the footballers, they suffer extraordinary stress on the heart. That time you can go for the Rostox. Rostox has incredible result to recover the heart valves. That patient, because he have the syndrome birth VST case, either it was EST syndrome, we have medicine to cure that, because that hole in the heart can be recovered. Our medicine, there is a calcarea fast medicine, there is a naja medicine, they work very well within few hours to 4 hours. If the patient is on sportive oxygen, just after having given few doses, that sportive oxygen will be no need to for the patient. Same thing occurs here when this patient are taking medicine, that 4 kg oxygen he is in per day, the sportive get rid of. Oximeter is showing now the oxygen saturation within 96%, 94% without the artificial sport. The froth which is coming from mouth is miraculously disappear. No more froth from the mouth. No crushing teeth is there. And the eye movement, eye blink is there. The symmetry of eye is not there. The reason is that there is an edema on the brain. And I have told them, because there is a surgeon's silence or whatever is that they go for the twice for the open heart surgery, because the age is too short, 18 years only he is, and he cannot bear this, and his brain goes to critical toxic condition. So on these all situations, the incredible result of homeopathic medicine is that the valve they replaced, after the replacement, the oxygen and the heart function is not okay. And the report, if that reports can be shared, MRI reports, CT scan, they clearly confirmed, all doctors, that these the heart, the new replaced valve is not working properly. So they put them on a lot of number of drugs, on the diuretic drug, on the electrolytic, some mood swings medicines, vasodilators, and beta blockers. So they believe that after having a lot of these medicines used, it'll be okay. More than 2 months, there is no recovery. The bed sores are getting increases. The gasping for breath is increasing. The breathlessness is increasing. Either the valve change. So this is the biggest struggle with the patient, that after having all kind of these surgeries, he is standing on very worst condition as he was not before. So it's from 29th of April to present the 29th of May, just in 1 month, that boy is recovered more than 60% regarding the symptoms of heart and chest, because the sputum, it was producing too much. They have to mobilize 8 to 9 times. Now they are mobilizing 1 time. Supportive oxygen nil, blood pressure and heartbeat is okay. Brain edema was reduced. Can we get that edema is reduced because of the movement in the right hand, in the left, in the right leg, and he is turning his head from right to left. He is stop crushing of teeth. He stops the continuously. This you can see, because reduce display. So all things you can see and they'll happen before our medicines. There is when he crush his teeth, the pain from his left temporal to lower mandible and jaw, and he like this, continuously crushing in this. This is a critical pain arises in his brain due to the edema. Edema is there because of stupidity and the way they have heart surgery, open heart surgery twice. For VST and AST cases, they have only one option, open heart surgery. Again, requires heart surgeons. To open the chest is not a simple thing. Patient needs months to recover. Why don't you contact and for the humanity to the homeopathic doctors? You can give you a very hot wall. You don't to go for TOF, tetralogy of fellow, or and patching for the heart. Really well, and that TOF, which was done at the age of 4 years to Muhammad Sam, that was punctured again. You can say medical language. The repair was punctured, and there is a region the dysfunction of pulmonary valve occurs. So symptoms and heart fiber. And 5 or 7 days before, when there is a doctor from USA, and that I don't know the name of that doctor, she said we use silkworm to treat I don't know what disease, but the silkworm, it's a very mysterious thing in the world. In Japan, they use the silkworm as a painkiller during the surgeries, after surgeries, or the history of RSA, roadside accidents. When there is a big clot and the brain, it's blocked the brain or body, that silkworm have the ability to dissolve the clots. And the heart is made of the Purkinje fibers, and that Purkinje fibers that will become dead or unable to absorb the oxygen. There is a or blue or purple spot within the heart. That spot is known as angina due to the lack of oxygen. Here is medicine cactus. Cactus works excellently on the Purkinje fibers purpose of heart. But here I would like to add that the silk cocoon works excellently to restore. If you want to power, there is some medicine homeopathy Arjuna for muscles energy. But if you want to rejuvenate the Purkinje heart, what you have to do? Please use cocoon silk medicine. I don't know, we have in our country or not. But that lady doctor in US, she made the medicine silk from silkworm. It's an excellent medicine. You believe me, use our medicines, the world best medicine for is available in homeopathic. No other science have, especially the naturopaths. They also have a lot of medicines, more than a and exact the safest way to have the medicines for housing. Toyota is that position, it's a very different kind of chin because it's also based in the that thickening prior heart chamber causes the ventricular hypertrophy. It was easily by homeopathic medicine. But the eta dislocation, it's a very different situation. I have seen one we go for uh, endoscopy and when they put the cameras and stick inside the arteries, the stick get broken. And it's very that radiologist or whatever the cardiologist who is doing this immediately called USA and asked about how it happens, and the stick was raked within the arteries of the patient. So they said there is another incident that it will go as the face of that stick, they touch it as we a flower, and that will last more than 8 hours in that room. Reason is that is more 80% from the junction. This case and the symptoms is like the pulmonary thrombosis. He is only having one symptom, which is you cannot find. There is a back, on the back of the lungs. There is a continuously pain, and he can lift his hand like this. Okay, if he like the gasping for his air, he cannot breathe properly and get just falls immediately, lie on the bed that I cannot respirate. So this is I have seen self that and there is another day covered with that need surgery. But what I have found here also, because that patient get treated only by one medicine, the location of aorta can be also medicine. And what is so amazingly, a very ready for the dislocation of aurum metallicum is made from gold, and more than 20 years before I remember, there is they inject with uh, the aurum, that is gold, to give energy to heart fibers, Purkinje fibers, so the patient can breathe. There is for the CRP, and after CRP there is motion to I think so one from long, the needle size, and they inject directly in the heart muscles. In that situation, that patient have the adjustment of to that in tandem or CMNC, more very rare have you nuances. He incredibly feels better, but very short time. And honestly advised to take after every 2 hour one dose of that aurum. So maybe you can feel more better. But unfortunately, he have to go for that surgery process. Surgery process, it's setting of SOTA. But how it happens, very important. Tetralogy of flow, when the patient, it's a patient of a sugar also. When it happens, when the patient not only heart patient, but he is also patient of sugar patient. Only sugar diabetes cause like that. When there's a dislocation of aorta, so other arteries blockage or the dislocation occurs. So I believe that the conclusion for this situation is that That first we treat his diabetes. When we treat his diabetes, then we will treat that dislocation and the arteries weakness. Because to recover the arteries and veins weakness, the one best medicine in homeopathy known as criticus. Criticus is a such kind of medicine. Month, the athletes, bodybuilders, the judoka, whatever, the sports they are related to any kind of sports in the world. If they believe they have to exercise heart and blood vessels and arteries, what have to take this? It's a very ingredient, especially the sportsmen use, known as the thermionic herb. It's a very famous medicine in homeopathy. And in the America, there is a craze for this medicine. It's known as coca. Coca is cola nut. Cola nut. The third name is that Circulia. That is an excellent medicine, which is a booster, energy booster in the body. If you know there is a ad of Red Bull and these are testosterone boosts and not boosters with caffeine. But there is a more strong booster. The history of coca is from Coca-Cola. It is when they use the wine, they need more energy, physical and mental. So that on giving just soda and wine to customers, he decided to find some incredible energetic herb. So that credit goes to founder of Coca-Cola, who found that coca have a very wide energy to give energy to muscle and brain. A wild energy was given by use of coca. So he used little quantity coca in the soda and wine, and when you have a single pack, it becomes like a more than. So coca is a medicine, excellent medicine. For the long time, it was also short in our country because the result is as thermogenic. The body love to have coca diet on regular basis to have the excellent energy. Here I am introducing this medicine to you because it's a very good heart stimulant. Those patients heart which have the weak Purkinje fibers, the function of heart is around about 20 or 30%. And this is a that physicians refuse. They said we even cannot transplant the heart, or that patient can be at the 12 or 15 hours and only live as you are living. So in that you can treat that the heart patient with the help of our. So my lovely, I love to treat VST, EST cases because my father is on him. I have seen a lot of cases from my childhood. My father is treating that children absolutely get recovered without any kind of surgery. And that surgery often fails due to a reason. Time for the civil and that. So that the is so incredible for me because the sharing I would like that if it is possible. So just presently see his condition after from 29 April to 29 May. It's only a month. It's only a month. In 1 month, after 20 days, oxygen sportive was removed. Crushing of teeth is okay. The blink of eye is there. The smile is there. And the movement of the hand and lower limb starts. So, achieve just 20 old boy will be okay after 2 months. He will walk and talk. I believe that. The will of God. So the request is that to if the cardiologists are there, please help to support our medicines to cardiology section and request them we can help you in these matters. Please don't go for the surgeries. This is also a target of our founder, father of homeopathic medicine science, Honorable Dr. Frederick Samuel Hahnemann. He said, go for the cure, not for the surgeries. Go for the medicine, not for the steroids. Go for the that kind of which is not used to treat go painkillers and steroids and antibiotics. This is what we want. So we have a lot of all medicines, but I think so there is lack of a platform, a strong platform, which can convince them. Which, because the hospitals are full of these trends, and you can see very rare few lucky patients who survived and visited to a homeopathic doctor. If the homeopathic doctor handle them well, they are out of all these issues. Even to treat the valves, the trust valves consist of three flaps, just like a fan. To, if that valve is defected, only give me Madorinum and Prostox. Excellently work. Especially you have found the patients who are having a high fever history, and the mitral valve was affected. So believe me, Rostox and Madorinum recovered that. So in regarding that critical situation for 18 years old boy, he is now out of danger. He is out of spot of oxygen. This is a big success of homeopathic medicines regarding the heart patient. So now I will just reply questions in having in the chat text. What is that? Someone
Yes,
asked
of
about
course.
the cocoon.
Interesting one, but unfortunately the network was not good, so the audibility was poor. That is a problem. Anyway, we all know that as a quality physician, always trying to learn new things. It's time for discussion. Those who would like to participate can ask some questions or can share your ideas or views to Dr. Ameer Malic. I think there's a couple of questions in the chat box. Cocoon, good for what? Pardon?
Cocoon is a regeneration medicine.
Pardon?
Rejuvenation. Second, you know, in Urdu, it's second janam. What I have to say, rejuvenation means to
Rejuvenation, isn't it?
yeah.
Yes.
Just like the newborn, we it's like and heart is damaged more than 80%.
Yes.
By the blessing of God, that your hearts become brand new, untouched, powerful fibers, powerful heartbeat. The
Yes.
cocoon, the silkworm, have this ability to create what?
Create what?
When the recreate the heart, recreate.
Recreate.
When we create heart, I try to talk from this the mobile, and so that my voice is not clear. This one.
It's always breaking. Your voice is breaking.
But my
Some audio, some echo is coming. Some problem. Again.
now my audio is okay.
Yes, yes.
Now,
There is some echo in your phone.
okay.
Yes, you can read tetralogy pilot, but you can't read this network problem. That is a challenge. I think he's not there.
My sound is okay now.
Yes, yes, good.
My sound is okay. Okay. I now the cocoon silkworm is used to treat the damaged heart if the heart fibers. When heart was damaged, when the heart fibers are dead, heart fibers are made of Purkinje fibers, and Purkinje fibers, when they are unable to absorb the oxygen, the black, blue, or purple spot rises in the heart, which shows that man, this person is having angina. When we go for the forensic for the heart patients, you can see what they have to check, how many black, purple, or blue spots are there on the heart. So when the situation is like that, the cardiac surgeons in the world just said there is no option for the replacement of heart even. So what they do, they just gives you the medicines and say live the life you have from the God. So that time, cocoons, silkworm have this ability to restore the Purkinje fibers, to rejuvenate the Purkinje fibers, to rebond the Purkinje fibers. So please use the silkworm to recover the damaged heart muscles. Because that USA lady doctor, she is using that, and I'm very happy because there is a lot of benefits. Not only this one, the second biggest benefit of cocoon, because this painkiller is widely used in Japan, they dissolve the blood clots within the veins and arteries, wherever the blood clots are there. Any place of your body, even in the liver, even anywhere, even in the brain, that is the best medicine. So this is the reason during the history of RSA, roadside accidents history, this is the best painkiller, best edema reducer, best blood clot dissolving agent.
Okay,
So
what
I think
about the potency and dose of this cocoon? Is it available?
actually, sir, I am using cocoon. I am using cocoon for heart patients, but I have just make it in the form of herbal form, and because it's titrated in copper, it's titrated in arsenic, because this is an excellent material to recover heart muscle energy. When there is more question, can you take this class once more? Was very informative. Was not clear. Okay, sure. Why not? Actually, today here is also a heavy rain, and since yesterday last night, I think so. The reason is that the distortion in the voice and the network. So I will definitely make it after 4, 5, 3 days, whenever the time comes. I will repeat it again. No issue. Any more question, please? You can want to ask. You can ask, please.
Does anybody like to participate? Please raise your hand. Dr. Marian, what is your opinion? It's from Bolivia. Dr. Marian, are you there? Yes. Marian Silcido. Yes. Welcome.
Hi, Dr. Manu. Hey, hi to all of you. Thanks for these little words. I'm agree with Dr. Ameer Malic. Thanks for the explanation that you had today. It was very nice, very important information as always. And I believe that we have to still working to make a big brotherhood to work for the human being, spreading homeopathy. So thanks for all your effort that you always do day by day, giving us being a very important expositors on all the conference and Zoom meetings on Ifph. Thank you very much, Dr. Manu and Dr. Ameer Malic for today.
Yes.
Thank you very much, Honorable Dr. Marian. God bless you a lot. You are also doing very good for the humans and humanity. Always thankful to you for the kind
we want
words.
an evaluation of our programs from you, Dr. Marian. How is our program and what is your suggestions, if any? Please.
Yeah, I believe that we have to involve more participants from South America, because I believe it's very important for all the epidemiological studies that we have to involve another point of views in all the world. So we are working with Dr. Danesh to have more participation from South America, Argentina, Ecuador, Brazil. And we have on July 1st, Dr. Gustavo Pirra from Argentina. He have been the translator for all the Germany into Spanish, the Organon 6th edition. And we will have Dr. Flor Carra and Dr. Ruth Deichmann too, to speak about the experiences during pandemic times and the experience with homeopathy on other kind of illness. Yesterday we was speaking about your experience in India, for example, and you have a lot of experience in acute cases, and we don't have that experience. And I believe this is very important to share all the information.
Yes, yes.
Because we can improve our practice, because you are teaching all your experience that you have, and we don't have that experience.
Yes. Yes. Thank you for your evaluation. That's most important thing. Those who would like to always to learn a lot from. In fact, homeopathy is a medicine of experience as well as experiment. We have conducted experiments on healthy human beings. Then, on the basis of that experiment, we apply the medicines on patients. So it's always experience and experiment medicine of. So Dr. Ameer Malic, my question is, please explain about this.
Okay,
Oh,
I have actually already messaged.
Yeah.
Actually, in the naturopathy, if you want to treat the things, they have to be in their language, in the naturopathic language. You cannot use the pure ingredient. You have to titrate and make it dead, and the effect of heals only comes out. To reach that skill, you have to titrate that ingredient in some another ingredients to get the pure energy and the power of that ingredient. It's actually, the herbal science is the most mysterious science of the world. So when you need the cocoon, best effects for the heart, you have to pastel, crush and rub it with the copper and arsenic. The quantity, because in the pure form, copper is also a poison, acid is arsenic is also a poison. But when you rub and crush and pastel these ingredients for a long time, the rubbing time of that ingredients are more than 8 hours, 12 hours per day. So after 7 or 14 or 12 days, that dose is ready to have it. You can take that medicine. But remember, be careful. These are like atomic bombs. The little quantity of that pure herbs, when you titrate and rub a long time or pastel them a long time, the quantity of that ingredient should be equal to one, the size of rice grain. The size of rice grain, it should be equal to the rice grain. And you cannot take it in the pure form. You cannot take it in the pure form. You have to take with the milk, with the butter, and some, like butter and milk is best thing, or with the egg, because it affects very good, and the side effects or the possible reaction of that ingredient will be reduced. This has happened. So in the herb, mostly they crush it. It's known as they around the seas, that coral calcium. They also used to rub it in coral calcium. So that is a very strong medicine you can use in that form. In our country, there is a famous medicine made from cocoon, but its name is Hakim Arshad. Hakim Arshad is the name of that herbal doctor who made an excellent formulation, and mostly doctors advise to use that. So that is purely made up of the cocoon, and it's excellent medicine. Please, any question more? Any question, please? Ahmed Hassan. Sir.
Yes, sir. Good evening, sir.
Good evening.
MashaAllah, very informative. And as Dr. Manoj sir asked about some analysis, generally I attended all except some I missed due to some work. The Canadian doctors, which last spoken very summarized way, that we should go for the very basic and very ground progress about this evidence-based. And also in Brazil symposium, there was one presentation. They told about that dental homeopathy. They mentioned so many things, but they also mentioned a specialized branch of dental homeopathy. So thank you very much, our learned organizers and all our lectures participants, to share this new development. May Almighty bless you. Thank you very much, sir.
Yes, definitely. In the coming days, homeopathy will spread more beyond this, the conventional track. It it will extend beyond the conventional tract and go to the veterinary field, the agriculture field, and this dentistry, then the cosmetology. A lot of options and possibilities are there. Safe possibilities. That is the most important thing. I think Paris sir is there. He's also a regular participant. He's always able to make some analysis, sir, please. Especially we are celebrating 1000 day. Yes, sir.
Am I audible?
Yes, sir, of course.
Dr.Ameer Malic, Assalamu alaikum. Yes, I very appreciate your wonderful approach for clubbing these experiments with the experience. It's a very tough topic. The topic would have been more effective, the presentation would have been more effective, but for the hitches, these technical hitches we had to face during the presentation. I think you will definitely come out with this presentation with the screen support and all that. These topics need screen support. The display of screen is very important because the nature of the topic is that. The topic is very important and relevant, and it's a new area, I think, for our treatment system. Anyhow, he has made an effort to make the topic more clear and all that, and we will listen to him for the next session in the days to come on this particular topic. It's very important topic, no doubt about that. I fully appreciate Malik. He used to be a wonderful and dynamic presenter of any subjects, and he will interfere with every topic and have a detailed interaction with everyone. Thank you very much. All the best. Thank you. Thank you.
Yes,
Thank you very much.
Really, we are surprised of the potential of this person. He's talking a lot of topics without any interruption and always blending different interesting subjects. That's another thing. Just like the cocoon, and he talk about the protein and the heart muscles and the heart valves are made of this protein. Then the interaction, very good topic, nice presentation, really an interesting too. Yes, Dr. Ameer Malic.
Yes, thank you very much, sir, for the kind words. And I actually, sir, I have a lot of love for our honorable seniors, honorable Dr. Sir Brava Pitu Khan, honorable Dr. Manoj, all our doctors. So actually, our passion in our blood is the homeopathy, which comes from India to my grandmother, and then from my father, and then to me. So I love it, and because I'm very much disheartened whenever I have talked, when I've seen in our country the situation of homeopathic is so worst. So I know only if there is a knowledge, there is the land of India, the land of Kerala, land of Germany, and all other lands. So it's a blessing of God giving me such to have fight for this. I believe